Hello, my name is Laura Schulte. I'm a reporter with the Milwaukee Journal-Sentinel. And in Wisconsin, rural hospitals are struggling. Closures are creating healthcare deserts for parts of the state. And what can be done federally to keep those hospitals open and providing necessary care to community members?
Yeah, I appreciate that question. It's a very, very serious problem. And unfortunately, this, like so much of else of what's going on in our country right now, is a problem that we inherited from the last administration. If you look at the number of rural hospital closures that were happening in 2022 and 2023 and 2024, it was really accelerating. And it's one of the reasons why it's not a provision that's talked about as much, but if you look in the big beautiful bill, the working families tax cut, however you're calling it, in that legislation, there is a multi-billion-dollar rural hospital fund to try to help these rural hospitals persevere in tough times, stay open, provide essential services, and get them to a place where they're on firmer financial footing. Nothing like that, I don't believe, Derek, had ever existed in the federal government before, but we said, look, we cannot let these rural hospitals just disappear, so we've created this fund to try to, support the ones that can stay open and try to slow the closures for the ones that are going to have to close. We think that we're starting to see some good evidence from those. It takes a little bit of time for that tens of billions of dollars to work its way through the system, but that's the number one thing. And then the number two thing is the Trump administration did a number of things in the first term, and we're trying to do this in the second term to give patients more choice. Because what we often do in our healthcare system, like for example, if you're a veteran, under the Biden administration, we would force veterans to drive an hour and a half away to a big city hospital when they could maybe go to a telehealth appointment in their own home, or maybe drive 15 minutes down the road to the local doctor. So we've tried to empower people to have more choice, because if they have more choice, they're going to be able to stay in their communities, which means more money going to those rural healthcare organizations, and that's the way that we save rural healthcare too. It's a tough problem. I'm not going to pretend it's easy, but we are working as hard as we can to make sure that the people in our rural communities still have access to great healthcare. Thank you.